Hello. In recognition of Sickle Cell Awareness Month, members of our hematology team and Sickle Cell Clinic have joined us today to discuss the importance of blood donation for sickle cell patients, as well as the impact of COVID-19 on kids with sickle cell. Today I'm joined by Alicia Leisure, CHOR social worker, Dr. Nadira Elamine, CHOR sickle cell physician, and Dr. Kimberly Sanford, VCU health physician and medical director of transfusion medicine. Thank you all for being here today.
Thank you for having us.
Thank you for having us.
So I'm going to start with some questions for Dr. Elamine. The first one is September is Sickle Cell Awareness Month. Can you give us a quick overview of what sickle cell is?
Sure. Sickle cell is an inherited red blood cell disorder. Specifically, it affects your hemoglobin. So patients without sickle cell disease usually have hemoglobin that is a donut shape. It's soft and flexible and flows through vessels very well and delivers oxygen to all of your tissues. But patients with sickle cell disease have an abnormal form of hemoglobin that's shaped more like a banana. And sometimes under stressful conditions, it gets hard, it gets inflexible, and it doesn't flow through your vessels as easily and doesn't carry oxygen as well as normal hemoglobin. And that can cause a variety of complications down the road, including anemia, some end organ damage, and things like stroke.
And for those who are diagnosed with sickle cell, are they diagnosed pretty early on in their life?
Yes, so all babies born in the state of Virginia do have something called a newborn screen, and sickle cell disease is one of those diseases that is looked for during that newborn screen. So usually all of our patients come to us as newborns.
Okay. And how many sickle cell patients are seen in the program here at the Children's Hospital of Richmond?
So we have about 320 pediatric patients that we follow in our sickle cell clinic. That includes patients from newborn to 18 years old, and that also includes all the different types of sickle cell disease that there are. We see all of those patients. And the wonderful thing about our sickle cell clinic is that we not only focus just on the medical aspects of sickle cell disease, but we also work with psychologists to help patients cope with their chronic disease. We work with educational consultants, and we work with social work so that we can provide patients with really comprehensive care.
Yeah, that's amazing. Really goes for the team approach that we have for all of our departments here at CHOR.
Absolutely.
So, as I understand, a lot of sickle cell patients receive blood transfusions. Can you explain why they're given blood transfusions and why that's so important, why they need it for just their everyday health?
Yes. So blood transfusions are a very important part of taking care of our patients. One of the main reasons that we use blood transfusions in our patients is because they develop anemia. That anemia is because their body is breaking down their own red cells that are abnormally shaped, and they just don't last as long. And so sometimes when our patients get too anemic and they develop symptoms from that, we have to give them blood transfusions to help them feel better. Other reasons that we give transfusions is to help with some of the complications that come from sickle cell disease. One of the most common ones being stroke and prevention of stroke. Some of our patients will be on chronic transfusion therapy where they receive transfusions every couple of weeks. And so that's a very important part of taking care of our patients. And so it's always important that we have a good blood supply for those patients.
Okay, well, thank you so much for all that information. It's definitely helpful for those who know a little bit about sickle cell or those who don't know anything at all.
Absolutely.
So Dr. Sanford, I'm going to turn to you for some questions. As we all are aware, COVID-19 is impacting every single piece of everyone's everyday life, especially for all of those in healthcare and those who receive treatment daily at CHOR and VCU Health and across Virginia and the world. So how has COVID-19 impacted blood donations?
So the blood donations, most of our blood donations are collected on mobile drives, whereas blood collections personnel will actually go to a university, a workplace, or a school, and they will perform blood drives, which is where we get the bulk of the blood that's needed every day to support the hospitals. When COVID broke out, there were, first of all, a lot of statewide stay-at-home orders which asks people to remain at home and not to travel unless for essential needs such as food and things of that nature. This also led to closures of large workplaces, which are ideal locations for blood collection establishments to go to collect blood from. So there were these closures of large workplaces, universities, and schools, which are the three areas that we target to perform mobile blood drives. This resulted in hundreds of thousands less blood donations within a couple of weeks period of time. In particular, what we saw our steepest decline were donations from minority blood donors. And in Richmond, I have a close communication with the American Red Cross locally, and they reported that there was a 70% reduction in minority donations here in Richmond. So we took an exceptionally large hit to our blood donations that are donated from our minority blood group donors, and that's important for our sickle cell patients.
And why are those minority blood donations so important for sickle cell patients? Are there special considerations for blood products? Is there a higher need for this patient population? Can you cover that a little bit more?
Yeah, absolutely. So we've worked very closely with our sickle cell doctors, and we try to actually match blood for our sickle cell patients. They're exposed to so many blood products each month. As Dr. Alameen has already mentioned, they receive blood typically monthly, either for anemia or for stroke prevention. And so because they're exposed to so much blood products from donors, they're exposed to different antigens that they may not possess. And when you're exposed to a blood antigen that you don't have on your own red blood cell, you start to make antibodies, which can then create incompatibilities for future blood transfusions. So here at VCU, we actually match our donors to our sickle cell patients, not just for different minor blood group systems, in addition to the ABO and RH that everybody thinks about, but we also test about 20 different antigens that these patients may possess, and we match them to the donors. In addition, we also have found, and the studies have shown, if you can use donors from similar ethnic backgrounds, then they also reduce the incompatibilities that they can develop over a period of their lifetime. So we do ask the American Red Cross to supply us with African American donations to minimize the incompatibilities that can develop over a lifetime of being exposed to blood from a different ethnic blood group donor. So that is something that we take very seriously here. And as soon as we're alerted that a patient is a sickle cell patient, they automatically go to that specific protocol at VCU.
Okay. So it's super important that we're getting donations specifically for these patients. So now that all different states and Virginia is in different phases of reopening, schools are going back, some people are doing virtual, how can you find out where to donate, how to donate safely and easily?
Yeah, so the entire Richmond area is supported by the American Red Cross. That's the only blood collection program in the city. So you need to go to redcross.org, and Red Cross is all one word, .org. And in the very top of the webpage, there will be a tab for Give Blood. And you can actually go to that tab and you can see all of the potential spots for blood donation. You do have to make an appointment now. You cannot do a walk-in donation because of COVID. There are very strict social distancing guidelines that must be maintained between donors. So you have to actually schedule an appointment to donate. But you can pick the location that's closest to either your workplace or your home place if you're working from home. And you can schedule a time that works for your schedule so that you can make that donation. And we ask for people to please do that. We are continuing, we're in our 7th month of blood shortages. I'm getting very tired. And we really implore Richmond area to please go donate blood. We are still in desperate need of blood.
Yeah, and I'll be sure to link the specific donate link below so that's easier for people to find when they're watching this video.
Excellent, thank you.
Yeah, thank you for all that information. So Alicia, now I have some questions for you regarding sickle cell patients and their life and life at chore and just at home right now during COVID-19. So how has this COVID-19 global pandemic affected sickle cell families and the care that they receive, especially at chore?
Well, I think, like we said, sickle cell, that COVID-19 has really kind of affected all families, not just sickle cell in many ways. But I think specifically for sickle cell, the fear that's around being a person who has a compromised immune system, in addition to having a global pandemic, can be really unsettling and frightening, especially for young children. So I think that has been the hugest impact. But in addition to that, the isolation from family members, from friends, even from their doctors and their support team, I think has been really huge, because a lot of our families really do utilize their extended family and their friends as a way to cope with the fact that their child has sickle cell, and that child coping with the fact that they have sickle cell. And so that's obviously been diminished significantly because of COVID. And I think that a lot of our families are trying to get creative with the ways that they're connecting, but it's just not the same way that it was. And then in addition to that, I think not having their physicians as readily available to them as they would like, where they can just come into clinic and they don't have to have an appointment and different things like that. We've kind of had to get a little bit more creative about how we've been able to connect with our families and making sure that we're keeping up with their symptoms and the way that, they're caring for their children who have sickle cell.
Yeah, it's really fortunate that we've been able to also help with telehealth and calls like these, and still being able to talk to each other, whether we can't hug and see each other and be face to face, but we can chat and see each other over video. So
Definitely.
Thankfully we had that, especially during this time. But as we just said, with phases of states reopening, people returning to school, are there any special precautions that families should take in light of COVID-19? Is there stuff that they need to keep in mind when returning to school?
So I think first and foremost, like everyone else, making sure that we're doing, proper hand washing, that we're maintaining social distancing, and that being exceptionally as important for our sickle cell families because they're at a greater risk. So keeping that in mind always. But in addition to that, just kind of going off of what a family feels most comfortable with. I think some families, because of their ability to work from home, they've been more comfortable with the virtual setting, with being able to stay home and feeling good about that because they're not risking their child going to school and getting exposed. But for the families who maybe don't have that luxury or can't be as flexible, I think, every family has to make that decision for themselves, which is tough. So there's not a one size fits all as far as what precautions to take. But I think each family really has to determine that for themselves and get support from their doctors and their teachers and their family to be able to withstand that and keep that.
Yeah, and it's important for those families to remember that we're here for you and you can reach out. We're always a phone call away, an email away, patient portal, and ready to respond and help you through that.
Yeah.
So just to wrap this up, are there any resources for sickle cell families that you could share? And we can link all of these below.
So I think the biggest resource has and kind of will always be within the sickle cell community, kind of the patients and the families themselves. I think a lot of the support that we see with our sickle cell families is drawn from other families connecting with, patients and kind of knowing somebody who has sickle cell, knowing somebody who has a cousin or a family member who has sickle cell, and kind of building that natural support system. And so that kind of going with our local community-based organization. They're called Living with Sickle Cell Inc., but they're a local organization that was started by a few of our parents who have children in our clinic with sickle cell. And so they kind of took it upon themselves to create this environment for families to kind of seek support and just to kind of rally together with each other. And they've started doing these virtual support groups every month with different topics. The next one is going to be on the 24th. But they have this open dialogue with all of our families just to kind of talk about all the things that all of our families are really going through, and being able to problem solve together and get creative with ways that they've come up with solutions for the various things that they're kind of facing now with COVID and working and doing virtual schooling and all of that. But in addition to that, really utilizing the school systems, just because they're not physically maybe present in the building doesn't mean that those supports aren't there. Much like how, you know, they might not come to their appointments in person to come see us all the time, but we're still here and ready to support our families. So I think really utilizing the school systems. I've had a lot of families reach out to me as far as like just assistance with meals and not having a child that's going to a school to get meals. And so a lot of the school districts have agreed to times that parents can either come and pick up meals or meals can be delivered. So just really remembering that those things are still in place despite the fact that we're all kind of having to do this different format, and to call and ask for help when you need it. I think that's the biggest struggle, is saying I'm at my wit's end. I don't have the resources I need and I need help. And so reaching out to the school systems, and then also, you know, just simple stuff like applying for unemployment if you're unemployed, and applying for food benefits if you are at a certain point where you don't have an income that can support you, you know, keeping the groceries full in the house, and just really, you know, asking for that help when you need it, and applying for those things, because they are there. And while the season of life right now with COVID, it looks a little bit different than what we're accustomed to or what we're used to, I think we all have to support each other and ask for help when we need it.
Yeah, I completely agree. Well, thank you all so much for joining us today and for putting this video together in recognition of Sickle Cell Awareness Month. If anyone has any questions, please leave them in the comments below, and we'll do our best to get back to you within the week. Thank you.